Hi, I'm Dr. Shen. I'm here to tell you about our upcoming CEREC Ultimate Experience, which is this yearly event from CADEC where we present interesting topics, most of which pertains to practical applications of digital technology in dentistry. Now, my area of expertise is anterior aesthetics using fully digital workflows. And this year, I want to talk to you about ceramic restorations of misaligned teeth, right? So the majority of discussions around aesthetic restorations usually focus on the intricacies of preparation, the curves and the symmetries in the smile design. But the reality is much more nuanced, and nothing is really ever perfectly aligned. So in the vast majority of times, our designs have to work around natural variations in the human condition, and this includes teeth that may not be in the ideal condition, in the ideal positions for, say, a veneer. So in my presentation, I will go through 3 clinical cases to illustrate the 3 most common types of misalignments for patients seeking anterior restorations, and they are diastemas, crowding, and missing tooth. So in each case, I'm going to go through the diagnoses, the keys to consultations and patient persuasion, and the preparation design, and of course, the ceramic choice. So whether you have years of experience or are just now getting into the market for aesthetic restorations, this lecture should give you a fairly good idea of the range of treatment possibilities as well as the common pitfalls to look out for. So if that sounds interesting to you, head on over to CADEC's website for a link to join us, and hopefully we will see you in October. Ciao.